everybody in Curacore land. Welcome to our latest installment of Anatomic Insights into Common Pain Problems. I'm Dr. Narda Robinson, osteopathic physician and veterinarian, and founder and CEO of Curacore Vet and Curacore Med. So that's me. I want to hear from you, though, also. And so please feel free to write in your comments or reactions. There is a little bit of a time delay, so I will respond when I get to them and see them. And oh, there you are. Hi, Ginger. Thank you. Good morning to you, too. So glad that you could be here today. Um, and really appreciate that. So, who does this target? Well, it's anybody who wants to learn more about your patients and yourselves. So I come to this from my osteopathic background because that foundation was really structure and function interrelated. And so I firmly believe that the more we know about anatomy, the better physicians and veterinarians will be. And one thing about the QL, or the quadratus lumborum, that we'll be discussing today is that it is probably the most overlooked, or just not even looked for at all, cause of back pain. Now, I'll be talking somewhat about the translational aspects of this because it really does differ when you're a biped or a quadruped, and the QL is going to be doing different things. So we don't, I think, have a full enough body of knowledge about the function of the quadratus lumborum in the quadruped, even the anatomy, because even for humans, and let's take a look at that in a bit, but even for humans, there's disparities among anatomic texts about the various parts of it. Are there 3 parts, 2 parts, 1 part? I'll get this guy again, front and back. So is there just one part that attaches from the lower end of that last rib, which in the human is 12 ribs? So from the last rib to the ilium, is it just one straight piece? How much of that connects with the transverse processes? Is it up to 3 different places where we have the one straight part, and then we have cross fibers? So we have different connections to the ilium. And let me show you this guy here. Hopefully this will good. So this is a human model. So I'm kind of jumping into it right away, but I want to just give you a visual for what I'm talking about. So in orange here is the quadratus lumborum, and I have followed somewhat the Travella and Simons, that trigger point manual, Bible of trigger point pathology, anatomy kind of insights, and made 2 of them. So you can see that in the human, we have a nice broad ilium here. Let me see if I need to take this down a little bit on the brightness, and lots of areas for attachments. And so what you can also note is that the quadratus lumborum is attaching medial or inside deep to the iliac crest. And then it's coming up and it's attaching below the ribs. So we'll get into how it's possibly an abdominal muscle in a bit, but it can go up to like the last 2 or 3 ribs underneath. And why it gets so overlooked is that, well, most of what we're looking at a lot of times are the erector spinae muscles here. So brighten that up again just a titch. And so here in red, I've tried to show the spinalis muscle. So these aren't even the deepest muscles. I mean, there are muscles like we talked about last time, the multifidi, the mighty multifidi, that are deep to this, and the rotators, and intertransversarii. There's a whole bunch of different muscles underneath this, but like with acupuncture, for those of you that have been in my acupuncture course, we know that we're focused quite a bit on that spinalis muscle and the multifidi for the huato points. And then this blue line, the blue pipe cleaner, is the longissimus, and in the quadruped, that's going to be continuous with the sacrocaudalis muscle, which goes to the tail. So very long makes it actually goes to the head too, but I just hooked these pipe cleaners to the rib up here that they would fit on, because that's not really the main focus of our talk today. And then the pink is the iliocostalis, coming from the wing of the ilium and then coming up upstairs like that. But really deep to that is the quadratus lumborum, and this left one fell off, but I have it over here, and we could just attach it like that. But really what happens is these are deep to, or attached at least to, the transverse processes. So you have the erector spinae group and all the deeper muscles. On top of that, there's actually a layer of fascia. So I don't want to get into all that right now, but just realize that these are hypaxial muscles. These erector spinae groups, now getting intermixed here, those are epaxial. So they're above, like, that horizon set by the transverse processes. And underneath that, where we typically don't go with our acupuncture needles, we have a layer of fascia. And actually, I'll just tell you right now, it's a layer of fascia that is created by the external oblique and the internal oblique, and I'll have a graphic a little bit later. But then it's called the transversus abdominis fascia that is enveloping the quadratus lumborum. And that's one of the reasons that some consider the quadratus lumborum actually an abdominal muscle, because it is continuous with the fascia of the abdomen. And even if you see here in green, I've depicted the psoas, the iliopsoas. So if we go from what we know to what we don't know, we have the erector spinae group that again, if you've been in my acupuncture, rehab, massage, whatever course, or others probably, you've learned about the internal and inner and outer bladder channel lines and bladder points that come between the longissimus and iliocostalis muscle, or in the lateral border of the iliocostalis muscle. So we're quite familiar with palpating those, and they are palpable. They are not the most superficial muscles, because of course we have the external oblique coming laterally, but the latissimus dorsi, the trapezii, different groups, and our beloved rhomboids, the rogue rhomboids that we've covered earlier as well. So we have about 4 to 5 different layers of muscles on the back. And then we have fascia. We have the thoracolumbar fascia that is actually going to envelop all these guys. So we're going to have fascia around these and in between them. And then we're going to have a different layer of fascia that is going to surround the quadratus lumborum muscle, and very, very interesting pathways for the spinal nerves. Here's another difference. These erector spinae muscles, they are supplied by the dorsal branches of the spinal nerves. So the spinal nerves are coming out of the sides of the vertebrae, the foramina there, and then they're going to split into a dorsal and a ventral branch. So the dorsal branches are doing all these things. But curiously and interestingly, and not surprisingly, actually, the ventral branches are what are supplying the quadratus lumborum and the green in there, the psoas. And so we have a different type of fascia. Some you'll hear different references talk about it differently, but what I can see and what anatomists have shown is that, yes, you have the thoracolumbar fascia that takes care of these guys, but then you have this transversus abdominis fascia enveloping the quadratus lumborum. And then the psoas muscle has its own little bit of fascia as well. And so when we're thinking about, okay, what do we know and what don't we know? We know these guys because I been talking about, and that we've learned those in acupuncture and rehab and all that other stuff. And now there's been such a fascination with the psoas muscle, psoas major, and that would conjoin with the iliacus and insert here on the lesser trochanter. Such a fascination with the iliopsoas for 15 years or so now, and so much gets blamed on it. But nobody's talking about the quadratus lumborum, and they share their neighbors, at least. They have different fascia, but it's all going to be mishmashed, gemished, and all this stuff. And also, the psoas major is supplied by the ventral branches of the spinal nerves as well. So if we want to, he's very flexible. If we want to, then we can think about this whole abdominal wall as coming around and the intra-abdominal contents being pressurized also by movements of the Valsalva maneuver with the contraction of these muscles. So, for defecation and blah, blah, blah. But the part of what we want to talk about is that interconnectedness. So while I'm on this on that topic, my first encounter with the quadratus lumborum, I didn't even know it. So while I was at CSU during my 20-year stint there, I would treat cats with constipation, and I don't know how well this kitty shows up. Maybe we'll use this other camera. Yeah. Okay. Well, that'll be good enough. Turn her around. Thanks for all your thumbs up, guys. So I would treat cats. I don't like that either. So if I treated a cat with constipation, I would do, the typical acupuncture along the back region for those spinal cord levels that subserve the sympathetic pathways that go to the abdomen. And even if you did Chinese medicine, you'd know that bladder 25 is the back shoe point for the large intestine. Well, why is that? Well, part of it is, now that we're looking at the quadratus lumborum, here I've outlined in orange this guy's where the pathway would be for him, and maybe he will show up a little bit better. Human's going to have to go. You've had your turn. Okay. So here we have the designation of where the pathway would be for the quadratus lumborum in this dachshund. And, it looks a lot like the bladder channel does for us acupuncturists. So here I've shown you the bladder, I think this is, let me see, here's 23 and 52, and there's governor vessel 4. So 23, 22, 21, 2019. So what I wanted to do was talk about how with the last rib there, so with bladder 21, just past that last rib there, that's where we know that we're going to get an anatomic attachment for the quadratus lumborum. So let's see if we can do this a little bit. Okay, so here we have, here it goes. Here we have a lateral view, and again, I depicted the orange as quadratus lumborum and green as iliopsoas. So what happens with this quadratus lumborum is that it attaches, as I've said, to either the inside of the last rib or the last 2 or 3 ribs, and it's coming down to the inside of the iliac crest. What does it do? Well, it's considered, especially in humans, to be a stabilizer of the spine. And it's so important that if you read the Travell and Simons book, you'll see that they refer to experts or whatever, that if, number one, if you lost your ability to use your quadratus lumborum muscles. It would be impossible to stand. It plays such a role in the biped, the erect posture, that you couldn't stand even with braces. Now, I've had human patients that have had seriously horrible quadratus lumborum trigger points, and that's when it would hit them. Is when they were standing, and if some glitch happened, and there's a bunch of nerves around this muscle, that it would knock them to the floor. It was like being punched. It would just knock you out. And so those are the really severe kinds of things. And if you're an anesthesiologist, you may be familiar with the quadratus lumborum block for local regional anesthesia or analgesia of the abdominal region. And if you read about it in humans, they'll talk about how to approach it, whether it's posterior or dorsal for vets, or anterior or ventral, also for vets. But so which way are you going to come at it? Because if you come from the bottom up, you do risk puncturing an organ. If you come at it from the side, are you going to be accurate enough? There's just going to be different nerves that are going to be accessible depending on which way you are locating the muscle on fluoroscopy. And so it can be deadly, but still people do it, and it bypasses the need for other forms of like more systemic anesthesia or analgesia, anesthesia, I suppose. But I mean, there are nerves from L1. There's the ilioinguinal and the iliohypogastric. Those are very seriously important nerves, and the subcostal nerves. And if you go too far down, you get into the lumbar plexus and sympathetic nerves. And that's when you can really throw things awry, get into femoral nerve problems and all that. So it really behooves one to be very specific when you're doing a QL block. But as with a lot of different approaches with anesthesia and pain control and pain blocks, we can see the overlap in acupuncture and where we are neuromodulating, because we're not saying it's chi and mystical stuffs and shamanic journeys and everything. This is neuroanatomy, neurophysiology, myofascial connections, and alleviation of dysfunctions and all that. So that's the beauty of things, is that the more anatomy we know, the better we'll be at things. But I think that most of you might not be able to remember being taught about the quadratus lumborum in vet school or other places. And, it's very hard to access. So if we come down to here, for example, let me show you just a little bit of a prettier picture here first. So this is an anterior or ventral view of a human. And you can see the artist has depicted the connection between the last rib and the transverse process, and also further out to the wing of the ilium. And you see how it's attaching ventrally. And here is the posterior or dorsal view, and you see how that happens. Now, that's just one kind of look at it. There's a lot of different renditions. This one looks very different. And so this is a stock photo, but it's talking about where trigger points are. And so you see the yellow diamond with the red circle in it. Those are locations where trigger points might be located. And the green stippling on the larger part of that human is where you might have referred pain. So I, for example, gave myself a trigger point this morning in that right one, right up near by the rib. But the point is that you have variability in the locations, even in the human, of where these attachments are going to be. Your best hope at actually feeling any of this is going to be on that lateral border. But you can know that they're there. And people will usually point to where it really hurts in the back, because that'll be a real deep pain. But it can also refer to the hip. It can refer to the hip, actually, the hip joint, so strongly, and the greater trochanter, that people can't even sleep, and they feel like it's their hip, and it's not. It's in their back. Another name for this quadratus lumborum is hipster, trickster, because it's misleading in terms of making you think you have a hip problem when it's your back. One of the things it does is it hikes your hip if you flex it unilaterally, or it can make you turn to the side if you flex it unilaterally, or it can extend if you flex it bilaterally, or just stabilize it. And so some people will say that the best thing is if you're not feeling your quadratus lumborum, you're lucky and that's good and it's doing healthy. But other things, and you see in Travell and Simons, I mean, there's a whole chapter just on the quadratus lumborum in Travell and Simons. But it's also called the joker of low back pain. And so when I had on my title side, the quadratus lumborum quietly causing lumbago, lumbago is an old term for lumbar back pain or lumbalgia, we could also say it. And so just as a mnemonic, quietly causing lumbago, what is that? Well, that is the quadratus lumborum. And so, but yeah, areas that it can refer to are sacroiliac joint, the abdomen, the groin, and as I said, the greater trochanter, or just really have a problem locally. And it's hard to palpate. And so even for humans, when I have identified it, I'll come in on that lateral border of the iliocostalis muscle and I just push medially. And that's where I have found in small animals, because I haven't really located in horses, but imagine if a horse had trigger points in this muscle that were so bad, at least for a human, that they would knock you down. But, oh, I see a very long comment here. Cool. I'm going to get to that. Great. Thank you. But yeah, imagine if somebody sat on your trigger point with 300 pounds or something, how horrible that would be and how edgy you'd feel. And even if you're a dog is running away now, even at my thought that I would put some baggage on his back and make him go hiking. And then put something on his face and not have him have freedom of movement for his neck, like we talked about the suboccipital muscles. Anyway, so that is the degree of unawareness that veterinary and human professions have. And just add this to the broadcast. And how very, I don't know if you can read that, how very severe these problems can be, at least as described by humans. So we have to know about it and we have to consider it in our differentials. And like I was getting to with the cat, when I would come by and palpate on the sides, I would call it the lumbar gully, because I'd be palpating on the sides and that would be where I would perceive a bunch of somatic dysfunction, so an osteopathic term, but just a lot of myofascial restriction. Hold on, let me get a drink. And that's where I would direct my acupuncture and my laser and massage and really work that. Also maybe work on the belly. And cats love their pecs worked on. They love their belly worked on, unless they don't. But I'm finding that, with the right approach, cat massage even for belly stuff within reason and with education, and come to our course if you want. But it's not that you can't touch the belly of a cat. You just have to do it correctly. And for horses, yeah, we can work with somatovisceral reflexes. But anyways, back to when I was doing this, I wasn't even aware of the quadratus lumborum, but there was something about that seemed like it was reliably effective to help their GI motion. And so remember at the beginning of this talk how I talked about you can do, it's part of your defecation thing. It's part of your intra-abdominal pressure increase. And so that's important. But if it was tender, if it was painful, or if other areas are painful, you're going to have things messing up, and you're going to get sympathetic activation, which is going to be anti-motility and pro-inflammatory. So the back is so hugely complex that now that we've been teaching with Clay, and like you can see with my other models, that to have to actually build these from the inside out is so informative, and it teaches you so much about interrelationships. And so I do want to go back to this comment. I'll read it to you. Ants Polane, I'm not exactly sure how to say it, but love that you're covering this. I find that in horses, quadratus lumborum is also very important section of the body, as it holds the power of either allowing for the thoroughness from the hind end or a complete blockage of the area. Throughness. It allows for the throughness from the hind end or a complete blockage of the area, especially where it is attaching to the last ribs. In cases of overuse, that edge of the QL between the tuber cocci and the last rib palpates hard as bone. Yeah, I can believe that. And the rib cage doesn't move during a walk, and there is no oscillation in the lumbar region. Great point there. So thank you for that. That's wonderful. And so for all these species, this is important. Now, what I'm curious about then too is in the dachshund, for example, or in any of these animals, how far up does it go? And I am finding, now that I've known more about it, I'm palpating it, I'm looking for it, I'm coming out of that lateral border of the iliocostalis and working my way in. And boy, the cats will tell you when you hit it. And even if you feel it on yourself, and if you do this and you're at the top of your iliac crest and you push in from the sides and go underneath, go deep to that iliac crest, deep to the iliocostalis, you'll kind of feel it when you get to it. It's like, oh, and you see your digestive situation might start to have more motility. And it's just a different feeling because the nerves are different. So we can locate it, as we talked about horses and dogs and cats and humans. But if it's not going to be in the quadruped, something that they're standing on, they need for stability vertically, what is it doing when they're horizontal like this? And I just think with as much connection as it has to respiration, to the ribs, it can help with forced expiration, forced exhalation, and certain amount of inspiration. So it's attaching to the ribs, it's attaching to the transverse processes, attaching to the sacrum, and has this correspondence, this continuity of the abdomen. It's like Grand Central Station. So how is it, aside from the genetic predisposition, how is it that certain dogs and others are prone to intervertebral disc disease at the thoracolumbar junction? I realize that, yes, this is a high mechanical strain location at the spinal transition zone. So that's one thing. But what is it that we could maybe improve here? Because if our quadratus lumborum muscles were satisfactorily doing their thing, along with my pipe cleaners, along with your erector spinae and the multifidi, who are very mighty in their collaboration from head to tail, then can we keep that spine intact and strong and resistant to damage? So one thing then that I've thought about in terms of let's use this one, in terms of down dogs and all that, what happened in your life before you weren't able to walk, before you became paraparetic or paraplegic? And then I'm asking, well, what was your life like? What is your life like? Are you not allowed? Okay, so this is from a cat person and human person mainly, but yeah, I don't like being jumped on by a big dog. Okay, or anything like that. So there's problems with that. But how are they going to keep their back muscles in good shape? So that's one thing. Not that you should be jumping on people all day, but what kinds of activities can they do out in nature or wherever, at the dog park, wherever they are, other than being led around on a leash? What do they need to do? Maybe it's on and off the sofa, I don't know, but to maintain strength and stability in their back before it starts to degrade and cause problems. So I think that is important for those of us in the physical medicine profession, acupuncture, rehab, and all that, to consider and to work on from very early stage. and how then also can it be overused, and like so much research is happening with agility injuries, and what's good for the back, what's not as good. A quick just thing I want to show you for participatory purposes is something that you can do to see what side your QL is tight on. And so hold your hands by your side and just go from one side to the other and try to touch your fibular head without cheating. So you have to just stay in the horizontal plane here. Remember that gallbladder 34 is craniodistal to the fibular head, but you should still be able to find your fibular head. And which side do you not go lateral as much as the other? So for me, I can't go as lateral on the right side, which means my left QL is tight. And just in the things that I ran across as I was preparing for this, I learned that typically it is the left quadratus lumborum that is tighter. And there were some explanations about the hemidiaphragms and which one is more complete or less complete. I don't know that that's true or not, but at least my left one was more tight. So just checking for other comments. I'm glad that you guys have participated like this. I forgot to give the disclaimer that this is not for, I am not your physician, I'm not your veterinarian. So if you're inspired by all this and want to find out more about how to treat yourself or your own animal, consult them. And if you want to reach me, you can contact us at info at curacor.org. And I think that's mostly it. But just in summary, know that it exists, and now you do. Learn how to palpate it from the sides, at least. Those are the ones you can get to. And especially also at those attachment sites like we saw in our comment. And think about, okay, how will massage help? How will acupuncture help? How will stretching? How will therapeutic movement? How will photomedicine, so laser and LEDs, things like that. So it was fun to be with you again. I look forward to our next session together in 2 weeks. We're trying to do these every 2 weeks. And that's going to be about Poppy the Popliteus. And we're going to talk about 3 ways that the Popliteus does popping things for good or for not good, and its role in health and disease, because it's anatomy that gives us insights into common pain problems as well as dysfunction. So write to me if you have other suggestions for our series here, and I hope to see you in 2 weeks. Thanks, everybody. See you soon.